title of my project is Effectiveness of Motor Imagery Technique along with core stability exercise on chunk control and visual plasticity in patients with stroke. It is a comparative study. So, stroke is a life-threatening neurological disorder, as we know earlier. The main causes of stroke is loss of trunk imbalance. The need for the study is uh, core stability, enhancing core stability and neuroplasticity through cortical activation. There are limited studies that combine both things. Aim of the study is to evaluate the effectiveness of motor imagery technique combined with core stability. Objectives: evaluating the motor imagery technique along with conventional therapy and comparing it to bring the outcomes. These are the review of literatures and added, and the first one indicates the improvements in motor performance through mental practice, and the second one gives the term control exercises that stimulates both motor and sensory pathways. The last one shows the tongue rehabilitation that improves the functional outcomes by targeted tongue rehabilitation. So, this is the Matter article I've taken. It shows the effect of motor imagery training for the tongue movements on tongue muscle control. The methodology: study design is comparative study. Study population is patients who have stroke poor control in tongue and neuroplasticity. The sampling technique is randomized sampling. The patients taken are 10 on each groups. The study duration is 6 months and the treatment duration is 12 weeks, 5 sessions per week and 45 minutes per session. SMS outpatient department in the study setting. And for inclusion and exclusion criteria, for inclusion, I've taken 40 to 50 years aged people and ischemic or hemorrhagic stroke patients. And the stroke must be their first. Post-stroke duration is 2 weeks to 3 months. Stable vital signs and minimal skill examination must be greater than or equal to 24 out of 30. And trunk impairment scale index that must be less than 30. Consent. Exclusion criteria is the orthopedic disorders if it is study participation to show special or visual field defects to maintain the balance. Current respiratory conditions, etc. Dependent variables, motor imagery techniques, core stability exercises, and conventional physiotherapy. Dependent variable is to improve trunk control, maintain balance, and improve functional independence. These are the outcome measures: trunk impairment scale to measure the trunk stability in sitting, work balance scale to measure the balance during standing and other daily activities. Functional independence measure to evaluate their day-to-day activities. These are the procedures. 20 stroke patients were selected based on the inclusion and exclusion criteria. They were divided into 2 groups, and these 3 scales were used to measure. The group A is defined motor imagery and core stability exercises, while group B is with conventional physiotherapy. Post-intervention outcome measures were rehearsed after 12 weeks. The techniques of motor imagery involved guided mental rehearsal of tongue movement and functional tasks. Post-stability exercises that is focused on deep tongue muscle activation and postural control. Exercise progress from static to dynamic or functional activities. The session lasted for 45 to 60 minutes and 5 times per week. Conventional physiotherapy includes strengthening balance and functional training. The data analysis that shows a significant variance in each of the treatments. For conclusion, motor imagery combined with core stability exercise significantly improved the trunk control. Greater improvements were seen in balance, functional independence compared to conventional therapy. The combined approach effectively promotes neuroplasticity in stroke patients. We didn't measure it directly, but it has been shown significant variance indirectly. Trunk focused rehabilitation enhances overall functional recovery And this intervention can be safely incorporated into standard stroke resuscitation.
Effectiveness of motor imagery technique along with the core stability exercise and conventional physiotherapy on trunk control, balance, and functional independence in patients with, for example, post MCA stroke. Compare this with next one. The same corrections can be done in aim of the study also. Same words, that is to evaluate the effectiveness of all these things what I said already. Okay. Next. Objectives. As I told you, the same words, but you have to change motor imagery technique along with the core stability. First point. Second point, conventional physiotherapy along. Third point, you have to combine both these things, both motor imagery technique along with the core stability and the conventional physiotherapy. Next. Yeah, the same words can be taken here, but you have to add, there will be significant difference. But same exact data words. Yeah. Next. Maybe complete the study. I told some changes in study population, right? Patient who had stroke with so which type of stroke? I mean, which artery? Which type of stroke? One thing. Then another thing I forgot to tell you, that is you have to add whether you are taking hemiplegia or hemiparalysis. From the starting to the end, you didn't mention it. Hemiplegia or hemiparalysis? Nowhere it is coming. So hemiparalysis or hemiplegia. You have to mention that. Then sampling technique, convenient sampling. Yeah, I told you 20 patients, group A. Okay, then in the bracket you have to mention that what they are receiving. Both groups. Okay, fine. 6 months, no, 8 months. 12 weeks, okay. 4 weeks follow. Next. Next. Is okay. Inclusion criteria, exclusion criteria, I have to speak about the type of stroke and you have to selectively particularize the stroke. And you have to speak the same thing in introduction also. That is easy to say. That is better actually. Personally working, fine. Yeah, here. You have to correct. You check whether you are doing the same thing in your project. Suppose if there is any change, you correct according to that. Okay. Okay. Then the results are all fine. There's no change there. And you have to add limitations and recommendations. Okay.